Thank you for joining us today. Today we are doing our fireside chat now, and this is on addressing health disparities and navigating care as a minority and LGBTQ autoimmune patient. I'm your moderator, facilitator, Dr. April Moreno. I am a public health researcher and the founder and CEO of the Autoimmune Community Institute. We're dedicated to autoimmune health equity. We also have Monique Gormassi. She is a global lupus patient advocate. We have Carice Hill, who is a disability activist, writer, and speaker, and Estela Mata, who is the co-founder of Looms for Lupus. Feel free to, each one of us, introduce ourselves today, introduce our pronouns, and even maybe our land acknowledgements. So my pronouns are she, her, and hers, and I am located here in San Diego on Kumeyaay land. Carice, would you like to go next?
Thank you. Yes. Hi, everyone. My name is Carice Hill. My pronouns are they, them, theirs. I am in Sacramento, California, which is on Nisenan land.
Hi, everyone. Monique Gormassi here, and I go by with the pronouns she, her, and hers. I'm in the tri-state area of New Jersey, and I'm a global lupus advocate, as Dr. April said, but I'm also a diversity and equity ambassador.
Hi, my name is Estela Mata. My pronouns are she, her, and hers, and I am a healthcare advocate and a caregiver and a fibromyalgia advocate, and I reside in California.
Hey, thank you. So in this panel, we are patient advocates, and we are addressing health disparities head on and how it affects and impacts care. Our panel will focus on tackling these challenges and offer care navigation recommendations for minority, POC, BIPOC, LGBTQIA+ autoimmune patients. And so we did create a list of terms today, and that should be available in the agenda as a handout, and that's available to provide some of the key definitions and terms we'll be using today if you're unfamiliar with them. Some of those terms include things like LGBTQIA+, include health equity, health disparities, and so on. So now we're going to be, we have introduced ourselves. Now what we would like to do is talk about what connects us to this panel personally, and what does health equity look like now in our perspective. So first, I would like to start with Estela.
Hi, so first and foremost, thank you guys for including me in this panel. And just to give you a little bit of background, I am a co-founder of Looms for Lupus, a nonprofit organization that illuminates, supports, and empowers and advocates for those living with lupus and autoimmune condition and other overlapping conditions such as fibromyalgia and mental health. And living with lupus or any autoimmune condition is life-changing. It may impact not only the person living with the conditions, but their loved ones as well and their caregivers. So that is why we support not just the individual, but caregivers as well. Providing support groups, healthcare literacy, empowerment tools to help with communication with the care team, tracking symptoms, stress relieving techniques, wellness modalities, and self-advocacy to ensure that everyone's getting the care that they need. So health equity is the right to health at the highest standard for all. However, in order to achieve that, we must first overcome the challenges and negative experiences minority communities face. We must ensure that the needs of all populations, according to specific cultural, linguistic, and environmental factors, are met. The social, racial injustice and inequities minority groups face were highlighted with the pandemic and has shown us the reality that health equity, or the right to health at the highest standard for all, has yet to be achieved. I am happy to be here today amongst this amazing panel in hopes of not only highlighting the challenges we face, but also to offer you, the audience, recommendations on how we can tackle these challenges that are preventing us from getting the care we need, the care that we all deserve.
Thank you. And Carice, could you share with us?
Yes, thank you. So I am a disability activist. I do writing and speaking, and I sort of freelance everywhere. I volunteer on several boards for health community nonprofits. I speak at conferences. I speak to you right now today, and I write for several outlets, as well as speak with media. I became disabled 8 years ago, or actually closer to 9 years ago, when I was diagnosed with spondyloarthritis, which acts like an autoimmune disease, but actually is not. But I do have an autoimmune disease as a comorbidity. I'm autistic. I'm also non-binary transgender. And I am a person of color, even though to many people I look white. To me, health equity, I think it's helpful to cover how I see health equity in 3 parts. One is visibility. That's visibility of all minority, marginalized, BIPOC, LGBTQ, all groups in research, in ad marketing for products and treatments, in advocacy campaigns, in leadership roles. And 2, accessibility is important. That means having disabled people involved at every level of anything from start to finish. And when I say disability, I mean chronic illness is part of a disability. And 3rd, cultural competence for advocacy communities, for nonprofits, and for everyone in the medical profession.
Thank you. And Monique, please share with us.
Thank you all so much for sharing that already. I really think what we're doing today is a great concept of moving towards health equity. We are pulling back the veil on conversations that we've tabled or that we've been afraid to have. So this is really a great feat in this conference and just sitting on this panel. This is an example of what health equity can look like when we do bring diverse voices, identities, backgrounds, cultures, ethnicities, languages, et cetera, to the table. And we're all intersectional individuals. So this is actually an example of what health equity looks like when it is unveiled. I also want to make a distinguish between health equity versus equality. And that's something that we often confuse, because equality is an idea of, let's say there's a high fence and the goal is to look over the fence. But if a tall adult can easily see over the fence and a shorter adult may need a boost, and a child or someone who might not be that abled needs to be lifted, we are talking about how can everyone do the same thing effortlessly, right? And so we want to make sure everyone has the same capabilities when we talk about health equity. And even more so when we talk about health disparities, the goal is to break health disparities, to remove health disparities. And that means addressing whatever social determinants might be a hindrance, addressing whatever biases or misogyny or homophobias or even implicit biases might be a barrier. And so we have to have hard conversations when we talk about health equity, right? We have to address our own blind spots. We have to admit our own indiscretions, and we have to say, I haven't done a good job with that. We have to also address the fact that when we're speaking to chronic illness communities like ours, who might have multiple autoimmune diseases, we have to say, I see you and all the different illnesses that you're dealing with, and I also see your identities. I see your humanity as a Black, Indigenous person of color. I see your identity in the LGBTQIA community. I see your identity coming from a Latino background or a Black background. So we have to find a way to merge all of those things. It sounds like a whole lot, but I think, again, like what we're doing here today, we're taking that undertaking on. And also, just even as we're having this conference virtually because of the pandemic, it was just this year that the CDC actually acknowledged that racism is a public health threat. Again, identifying and calling these things into play and making that acknowledgement is really important about fighting health equity.
Thank you, Monique. You made so many wonderful points. And I would like to also share my experience with health equity, how I connect to this panel. Our nonprofit is dedicated to health equity. I am a PhD researcher in public health and health informatics. And what I found was that we were missing in so much research. During my third out of the fourth year of my PhD program, I was diagnosed with my autoimmune condition, had no idea what that meant, had no idea that I was disabled, had no idea about what this looked like. And I would go to my disease communities and see nobody looking like me. And then I would be asked these questions about, why are you here? You don't look like you should have this. And just finding that we were so missing in a lot of the research. And then also in terms of health equity and intersectionality, I love that we're bringing up these important topics. And also, as Carice mentioned, the idea of what's visible and invisible. There are so many, we can probably talk for weeks about all these various important topics and issues. As a Latina, as an Asian American, and as an African American descendant, there is so much that is missing visibly that you would not see culturally and accepted how it's accepted. And then living with a chronic illness that is autoimmune, you do not see that. So there is so much that is based on what is seen versus not seen. And then also, as we talk about these issues of health equity and disparity, intersectionality, and understanding that we do have all of these intersecting identities and contexts that we are dealing with within and then from without. And there's a lot to be discussing here. So that's kind of what health equity, I think, looks like now. We are addressing this. We can complicate it and break it down in so many ways, but in other ways, this is normal life. This is us, and we've always been here, and this is just normal. Okay, so the next topic here is about navigating healthcare. So tell us a bit more about your personal experiences navigating healthcare. What is your advice to fellow patients who may be experiencing the same types of disadvantage or discrimination? So I would like to begin this one with Carice about navigating healthcare and those experiences.
Thank you. So I think I will focus on my experiences as someone who is transgender and who uses pronouns that maybe the average doctor will not know by looking at me. I live in pain. I have a chronic disease that involves seeing many specialists. I see multiple doctors every month, and I'm sure a lot of you will relate to that. And, you know, that involves prioritizing what pain you treat first, what condition you focus your treatment on, what doctor you see this week versus next week. And then for me, there's the added layer of also wondering whether the doctor is going to see me as a person if I say, my pronouns are they, them, I don't identify as this gender that you think I am based on how I look. And I honestly navigate my care from a place of fear because of my identity as a trans person, because I'm not sure if I'll be safe if I out myself to a doctor that, you know, I don't already have established care with. So I'm often having to make the decision on whether I treat my chronic condition while hiding my actual gender, or even adding my trans care like testosterone, like maybe I want gender affirmative surgery someday. Those choices affect mental health, and we're already dealing with mental health issues just having an autoimmune condition. So that's sort of the context that I'm coming from. A big tip I have for anyone in a similar position is document, document, document. We face, you know, issues where we're talking to multiple medical staff every week. Everyone's saying something different. I always write the time and date, who I talked to, what we talked about, and I keep that log so that I have documentation of what multiple providers are saying. I always take notes during medical appointments. If I'm experiencing a skin issue or trouble breathing, I always take a picture or a video so that I can prove it when I'm in the office or in the emergency room. Another big tip I have is to always have an appointment buddy or an emergency room buddy so that they can advocate for you. A lot of times, especially if you are female presenting, we know doctors don't pay attention to our pain as much. And so having someone there to advocate for you and also just as mutual support is a huge thing. As a trans person, I often wear my pronouns pin on my chest that says they, them. I even have a shirt that says not a she. And I'll dress more masculine than I might want to, so that if I do get misgendered, the doctor thinks I'm a man, because that feels, slightly more, slightly better than the other way around. And another big thing I would suggest is to connect with people like you. That is exactly, let's see, how do I say this? That's how I feel whole in my identity, and that gives me the courage to be my whole self when I present myself to doctors.
Thank you. And Monique, could you share your experience?
Carice, thank you for sharing that. Your authenticity and just I'm really moved by you. So I just want to tell you thank you for that. I think we all come with so many different modalities when we approach healthcare, because we're all such different individuals with even these symptoms and the diseases that we're dealing with. And so when I was diagnosed with lupus 11 years ago, I didn't understand how it was even tied to me being a woman, being tied to African ancestry, and all the other different layers that came with that. My first interaction with just even being an autoimmune patient was when I was months old. I dealt with eczema from the time I was about 3-4 months old, and it progressed and got worse. And my parents actually put me in a trial when I was around 7. And I was involved in this trial for about 10 years, going through my adolescent years. So I really wanted to get the idea of being a patient, having to deal with all the specialists and dealing with the chronic illness and these underlying conditions. I wanted to get that behind me. I'll be really honest with you. I did not want to be someone that wanted to feel empowered navigating the healthcare system. And I didn't feel like I wanted to be an advocate, because I felt like as I grew into my womanhood and just even really trying to figure out my own identity in America, coming from an immigrant family, there was already enough obstacles and barriers that we had to fight with. And so once I started to receive additional diagnosis, it took me 2 years to be diagnosed with lupus. And then it led to fibromyalgia and lupus nephritis and pericarditis and several other itises that came along with that. It was really traumatic, additionally traumatic, because as someone of color, I had already been dealing with the trauma of living in this country, living in this skin with this identity. And so I approached it already completely stressed, burdened, and navigating the healthcare system was not something that I did with ease. I heard someone earlier talking about, just kind of the level of comfortability they had. And that's not the comfortability that a lot of us have when we do engage with the healthcare system. So I didn't ask certain questions because I wanted to get in and out of the appointment. And then when I did ask certain questions, I was disregarded. And I remember being told by one of my rheumatologists, this was probably the 3rd rheumatologist that I landed with, that I was a tough cookie and that I would definitely be able to tough out some of the pain that I had. And I remember thinking, do you literally not hear that I'm not able to get to work? I can't get out of bed. I've been someone who is an athlete my whole entire life. I played softball semi-pro. This is not normal, right? This is not typical. And I don't want to have to tough this out. I want you to address the pain that I'm in, the debilitating issues that I'm having. And, fast forward, I remember when I really started to get into research and advocacy and learn just kind of even the mindset of how it was for someone navigating the healthcare system, the myths that were also associated with people of color. I remember an AMA study that I read that half of the white medical trainees believe the myth that Black people had thicker skin or less sensitive nerve endings than white people, right? And so this false notion was tied to the hidden biases that I would be able to tough it out. So for me, navigating the healthcare system has always been a fight. There has never been an easy way to do it. It's never just been, let me write my symptoms down or let someone come and advocate with me, because the person who was coming to navigate with me, they wanted to get in and out just like I did. They were coming from the same cultural background. They didn't have the health literacy, the cognitive understanding of what it was like to navigate from the insurance aspect to the digital aspect of, the electronic record system. We had no understanding of that. So even with me thinking that I was bringing myself informed from a standard educational perspective, that wasn't the same when I approached the healthcare system. And so I didn't feel valued, I didn't feel respected, I didn't feel heard. And so that's what led me in the direction, unwittingly, I will say I did not willingly want to be an advocate, but that frustration drove me to want to do more, and not just for myself and people that look like myself, but for others, right? People that we typically don't even identify and that don't have a voice and are underrepresented.
Beautiful. Thank you. And Estella, could you share your experiences?
So for me, it's a little bit different. And thank you, both of you, for sharing your experience. For me, I've been in healthcare for almost all my life, for over 30 years. So it was a little bit easier for me to navigate as far as knowing the terminology, knowing the medical group side, what's covered, what is a coinsurance, and everything related to that. But it wasn't easy for me to get my diagnosis of fibromyalgia, because sometimes too much knowledge is not good, because you are seen a little bit different, and sometimes providers are intimidated by you because you come in with your checklist, you come in with your next, this is what we're going to do next, or we've already tried this, and you pretty much have all your answers. So you leave the providers kind of wondering, wait, you know it all, then go treat yourself, So you could get dismissed by knowing too much. But what I want to share with you is not my personal experience, but my experience as a caregiver and loved one. My sister, Juana, was diagnosed with lupus in 2009. Now, with lupus, not every, and like a lot of autoimmune conditions, not your symptoms are not always visible, just like disabilities, they're not always visible. So with her, she's always looking beautiful. She was feeling sick. She goes to the urgent care. They dismissed her. They told her, go home. There's nothing wrong with you. She got a diagnosis of anxiety, and she insisted, there is something wrong with me. I have all these symptoms. So she listed all the symptoms, and the doctor basically said, no, you look fine. Go home and come back tomorrow for your labs and for your lab results. She insisted. Hours later, she finally got to him. He diagnosed her with anxiety, but got some lab results. And why did she do this? And why did she continue to be persistent? One, I was on the other end at the patient portal telling her, you didn't get the lab results yet. They're not in, right? Because I knew a little bit about the patient portal and all of that. Now I know more, like the reason it wasn't coming through is because some things don't come through on a patient portal, number one, and number two, the doctor had not ordered the labs right away. So long story short, she convinces the doctor, and her platelets were at 6,000. And normal is 150,000 and up. So literally she was bleeding internally and dying. If she would have gone home, like the doctor said, she would have died, because at midnight, her platelets were at 2,000. And there was a shift in doctors, and the new doctor looked at all her symptoms, and we had a huge list. And again, I kind of figured she had lupus because I listed all the symptoms I had been documenting, but I was afraid. I didn't want to tell her what I thought she had. And who am I to tell her, this is what you have, when back then there was no cure for lupus. There were no specific FDA approved treatments specifically for lupus, and she could die from it. So I didn't want to scare her, and I was scared myself. But she got the diagnosis. By midnight, her platelets were at 2,000. She was admitted to the ICU for 7 days. She looked as beautiful as she did when she came through, fighting for her life. and she is alive today because she advocated for herself. And why do I share that story? We share it because we want to encourage everyone to take charge of their bodies, to take charge of their health control. So yes, it's scary. Yes, it's sometimes intimidating. And sometimes you're not going to get the answers, and some doctors are not going to be the right fit for you. Some doctors may dismiss you, but you have to not give up. You have to continue searching for that right doctor, for that right connection, for the right care team, because at the end of the day, you have to advocate for yourself. You only allow the system to play you until you say, you know what, I've had enough. We are having this conversation today because we have all had enough. We want things to change. We advocate because we want change, and we want to cause that ripple effect. So if I could, the advice that I give to people is learn about your condition, document everything, just like, you guys were talking about, we have to list everything. It's not about going in and out of the doctor. It's about asking the questions and getting the answers to the questions that you come in with. Getting that patient advocate next to you. If you don't have a loved one to come with you, write things down or email the provider. Now there's so much technology. Email them, take pictures of your, if you're having issues with your skin or whatever issue you're having, be prepared. Also adhere to your treatment. Document, is it working? If it's not working, go to your doctor, let them know it's not working. Maybe also be part of that action plan and say, I've already tried this. Let's work on something else. So communication, trust, and advocacy, self-advocacy, I think are the three things that I wanted to share and tips that I can give.
Thank you. And yes, it can save your life. I would also add that during that sometimes very long process of getting a diagnosis, just being yourself best self-advocate, continuing to ask those questions, continuing to pursue the second opinion, the third opinion, the fourth opinion, the fifth opinion, until it sounds like it makes sense to you, that you feel that you can trust that provider, that specialist. Until you can do that, keep asking for another referral, another opinion. So that was kind of my experience the first time I was diagnosed with my optic neuritis. They told me it was an eye infection. Here, have some antibiotics. I'm like, okay, I'm going blind in one eye, but you think it's an eye infection. Okay, right. And then when I was diagnosed with MS, that, I didn't trust that neurologist the first time. So I did make sure to go to a second opinion. And I made sure personally as a researcher to go to a research hospital. I was also becoming a postdoc and things like that. So I'm in a kind of unusual space where I'm a researcher researching myself and my own disease and communities, and then finding the gaps in lack of people of color. But, having a place where I can actually trust my specialist now, having a place where they actually can respect the fact that I'm going to research just as much as you know the research, because I can do that. Anyone can do that with PubMed, Google Scholar, and so on. So just being that advocate can be very important. So yeah, just continuing to do so. So it looks like we have maybe less than 15 minutes apparently for a wrap up. So we'll go ahead and go through these. It looks like about 3 minutes each. Carice and I will be discussing a little bit about finding community. So Carice, what does community, what has it meant to you? How can you find, or how have you found communities in your identity group?
Yeah, thank you. Before I start, this is an amazing conversation, and I don't think we'll have time to get through everything that we wanted to talk about. So I'll make this as brief as I can. I want to say how finding the right community, for me specifically, and it's going to look different for everyone, has meant that I stopped having internalized ableism, and that can look like a lot of things. That can look like waiting too long before you use a wheelchair, or hating your body, and not feeling whole even when you're broken. And that's a long journey. Everyone's gonna get there at a different timeline, different route. But yeah, community helped me understand my own internalized ableism. Community helped me claim and identify proudly as a disabled person. And, understanding all the nuances of what that means, what that looks like. And community is what encouraged me to use those mobility aids, those accessibility aids, to reduce fatigue, to reduce pain, so that I can do more. I mean, their purpose is to help you function. I love my shower chair. I take pictures in my shower chair because, we can be sexy. We're allowed to do that. We're disabled, we're chronically ill, but we're still human. And, mobility aids don't have to be ugly or something that you hide. And I think finally for me, finding community was on Twitter, where I found disabled neurodivergent trans Twitter. And it's how I've gotten my Ehlers-Danlos diagnosis. It's how I learned to identify as autistic. And just having community that looks like you is how you can find validation, have less shame about yourself, and learn how to be whole while even being broken on your own timeline.
Thank you. And yeah, I agree with the internalized ableism. There's so much that we have to kind of decondition ourselves from and kind of relearn, right? We have to just kind of learn new things because we have heard all sorts of things, and just building that awareness of diversity is important. And so community, in my case, has a lot of it has been on Facebook. This is where I met the women of color with MS. I didn't even know we existed. Researchers said we didn't exist, seriously. And so this is where I found my favorite community on Facebook. But then also, once I started the Autoimmune Community Institute, just being dedicated to autoimmune health equity, I met so many wonderful, diverse individuals, people of color, and allies who are living with autoimmune conditions. And we just really strengthen each other. And I love it so much, just the friendships we've made online. So the next question has to do with research. And so we'll be pretty brief, maybe a minute or so each. Monique and I just talking about research in autoimmunity. What does that landscape look like? How can we change research to be more inclusive and diverse? How can patients get involved?
Right. So being very brief, I don't have a healthcare background. I've grown into this area, and that's been through advocacy, through awareness, and now I'm doing co-investigating work outside of speaking on panels and writing and participating on advisory boards. The research part has really become a part that I'm passionate about because representation matters. I think we are hearing that more and more. This pandemic has brought that to light. And even as we're having a better understanding of who is involved in research and what research actually sounds like to some individuals, this comes back to what we talk about with health literacy and digital literacy. Some people quickly assume research means clinical trials and it's interventional, but research is observational. It includes surveys, and all of us can be involved in research. One, because we want to be able to identify with the data that's going to be life-changing for us. We want to be able to know what are the outcomes if this information is published. We want to know who are the individuals that were part of the research. And oftentimes the data that was aggregated might be from 15, 20, 70 years ago, and there weren't populations of certain identities and backgrounds. And so we can actually be a part of that and kind of saying, I'd like to find out how I can become involved in research. I can share information. I can become a trust bearer and get organizations involved in research. And also we can be very selective. I know patients sometimes want to be the #1 advocate, but we don't have to partner with every organization that does not value us culturally, that doesn't value our faith, doesn't value our mental health, our sexual identities, our sexual orientations. We have to make sure that those organizations are also held accountable. Who's handling the research? Who's on the board? Who's the investigator of the research? We need to also call them on the carpet about these things, because we're these stakeholders as well. We are partners, we're collaborators. And so these are terms that we need to be familiar with. We should be asking for access to this information so that we can make truly informed decisions.
Thank you. All right, here we go. So let's talk about research. So CBPR is our favorite type of research at the Autoimmune Community Institute. And that is because it includes the community. It includes stakeholders at all levels from beginning to end. There is such a type of research that actually exists. So you would include people in the community. You include their voices to decide what the research is going to look like. What are the actual needs in the community? What do we actually care about? And then also like having them be involved in that research process, the data collection, the outreach, connecting with other people, and then learning how to analyze the data. If they're interested in becoming researchers and working with data analysis, we train them, we provide that resource and opportunity to them. And then we present the data. They are involved in that presentation of data. They're involved in the authorship of that data. And then they know the end product of what's going to happen with that data. And we want to make sure that it's something that is practical. It is what we call dissemination research, which is usually top-down academic to the people, but we are within it. We are part of it. And so that's what we do at the Autoimmune Community Institute. I'm really passionate about the fact that we are part of that research. We are sharing our insights on what is important to us. And also, like, as you mentioned, we have to be very careful and very wary of who we are working with, because there are people whose values are very different from ours. They are using it as a checkbox. This is like an EDI moment. This is a diversity moment where people don't want to be seen as the organization that doesn't include people of color, because it makes them look bad, more so than whether they really care about it or not. So that is something we really need to be very careful and wary of. So that's why we exist as an organization, because we know that there are people who are just looking at, oh, we needed another group. We need a control group. We have to include majority white population in this study because we had to compare them. Or, oh, we just didn't find enough people of color in this study. So that's why, even though it's a minority study, that we still just have mostly white people involved. This is huge. This is something that we see so much about. And so I have to share that. That is something I'm very passionate about. And then now, as we finish up here, we are talking about advocacy. And so this is Monique and Estella. You have a few minutes to just share with us as we close this presentation. Please talk about, let's start with Estella. What does advocacy look like? How can others get involved?
So thank you guys for sharing about what this research. I'm actually doing a study with a Fitbit right now on long haul COVID effects. So, we're trying to figure out what's going on in my system, and I wanted to be part of it because I am Hispanic, Latina, and I wanted to represent. And if it's going to help someone else, then, that's why I do it. But as far as advocacy, we started advocating or just speaking out loud and raising awareness about lupus and how to take over, your healthcare and just different modalities to relieve stress, and all of that locally at a local level. So we would meet, with whoever we're meeting. If we're at the market, we talk about lupus. If we're at a support group, we talk about it. And we would also go meet with our mayor, our local legislators, and we would request a proclamation declaring the month of May as Lupus Awareness Month. And it would give us the ability to not just share it with one person, but with the whole community and then the mayor. And then it would be, written in history that it's at, May in that year, that city was declaring a Lupus Awareness Month. So we did that locally. Then we took it up a little bit higher to the California, to a state level. And we partnered with other organizations so we wouldn't do it alone, and so they wouldn't do it alone, and to just be a community. And then we started doing advocacy more at, with legislators at a national level. And there was where we realized that, it wasn't just about raising awareness, but it was about that change that we could make. And I think Monique kind of mentioned this. It's about what affects us, right? Policies, and being able to talk to legislators about policies that are impacting us, and humanizing and letting them know how lupus and how research and how treatments are impacting our lives, not just those living with lupus, but the families, their loved ones, and the community as a whole. So that opened up our eyes, and we've been advocating for lupus, fibromyalgia, and mental health for a while already. And one of the things that I would like to share with others is you can do this as well. We actually help any other community members. We've had up to 15 proclamations in different cities, where if people live in those cities, we help them do the proclamations, and then they go and accept the proclamation. They get to talk about lupus and feel like they're, advocating in their city. So if you guys have any questions, we'll probably put in our information, or you guys can visit our website. We have all the details there, or you could just simply reach out to us and we'll help you.
Thank you. And Monique.
So, just in closing, I want to say, even with a lot of the work that I've done through advocacy, it's grown over the years. I was diagnosed 11 years ago, and I've been doing advocacy for about 8 or 9 years. And advocacy change and advocacy looks different for everyone. So I just want to say that, because, sometimes we are wondering, well, I want to speak, I want to present. There are things that we can all do in our own neck of the woods. And most importantly, I've been involved in campaigns. I've done work with researchers locally, globally. I've done international work. I've done fundraising. But what's most important in advocacy is when I shut it down, I do self-care, and I say what's important to me and my own wellness today. And I really want to remind everyone that, because how we work in advocacy is through collaboration and through partnership. And the partnership works at every level of being a stakeholder. We want to be a parent, we want to be impactful from ideation to scale, but that only works when all of us are doing this. So I can't be going, and not tag Carice when I need to and tag Estella when I need to. So that's really, I think, what's important, that I want to make sure we have an understanding. Advocacy is not burning yourself out. Advocacy is not re-traumatizing yourself. It is not exacerbating your chronic illnesses and autoimmune diseases so that when you go to your doctor, you're like, my lupus is flaring, fibro is failing, my medication hasn't arrived, but you're doing all of this advocacy work. Advocacy is saying, how am I today? Have I taken care of myself? Am I speaking to my mental health provider in addition to all the other providers? So it's really important that we just bring all of that back into, how am I doing? How am I being impactful for me? And then how am I also carrying the burdens of other individuals? But just remember that advocacy involves each and every single one of us.
Thank you. All right, looks like we are out of time today. Thank you so much, all of you, for joining us, being part of this presentation. And yeah, until next time.